My name is Teresa Johnson. I'm with Adult Protective Services, and I work in the River Valley office in Columbus, Georgia.
Thank you. And Ms. Johnson, she has been such a tremendous help. Even when I'm in my role of being an ADRC counselor, we have had to reach out to Adult Protective Services, and Ms. Johnson, she gets a lot of the cases. She's right on it. As soon as she gets it, she is getting to work. So she's going to be just giving us some information regarding Adult Protective Services. Today, I've noticed, and some of the other ADRC counselors, we've gotten a lot of calls regarding elder abuse, especially since the pandemic has occurred. Not sure why people are not getting enough time by themselves, if people are taking advantages of the of these uncertainties. So I thought it was very, very important to get Ms. Johnson and Ms. Lloyd on so we can see what is going on, because we're also getting a lot of calls regarding options for nursing home care. So I'm going to let Ms. Johnson go ahead and go first, and then we'll introduce Ms. Lloyd, and she'll go as well. So the floor is yours, Ms. Johnson.
Okay, and I think someone is going to be doing my slides because I can't seem to share mine on my end.
Okay, just let me know when you're ready for next slide or advance, however you want to cue me.
Okay, all right, and I think we can go ahead and get started. This is the next slide. Our vision at Department of Human Services is stronger families for a stronger Georgia. Adult Protective Services is the state entity charged with investigating all reports of abuse, neglect, exploitation of older persons 65 or older, or 18 years old with a disability or older, who do not reside in a long-term care facility pursuant to the Disabled Adult and Elderly Person Protection Acts. Next slide. Adult Protective Services are those services necessary to protect adults with disabilities and elderly persons from abuse, neglect, or exploitation. Such as services shall include, but are not limited to, evaluation of the needs for services and mobilization of essential services on behalf of the adults with disabilities or elderly persons. Adult Protective Services are intended to reduce further deterioration in a client's situation, protect the rights and resources of vulnerable adults, reduce or remove the risk of threatened harm or danger, enables adults to manage their own affairs to the extent possible, report to and collaborate with law enforcement. There are several different types of abuse: physical abuse, mental, emotional, verbal abuse, sexual abuse, neglect, self-neglect, and financial exploitation. In our office, we sometimes see a lot of financial exploitation more than anything. It seems to be on the rise lately. Next slide. Physical abuse, using force to coerce or inflict bodily harm. It often, but not always, causes physical discomfort, pain, or injuries. Indicators of physical abuse are pushing, striking, slapping, pinching, beating, hitting with a hand or instrument, rough handling, improper use of restraints or medication, bruises, burns, broken bones, or pain. Emotional abuse diminishes the person's sense of identity, dignity, and self-worth. Indicators of emotional abuse: verbal abuse, including threats, insults, harassment, name calling, and intimidation. Isolation, giving the silent treatment, making derogatory or slanderous statements, repeatedly raising the issue of death. Neglect occurs when a caregiver refuses or fails to provide essential services such as food, water, shelter, medical care, etc. Indicators: failure to provide shelter, clothing, food, water, medical care, or other basic needs, untreated medical and dental conditions or injuries, malnourishment, dehydration, weight loss, bed sores, or rash. Self-neglect, we have to keep in mind, is not a crime, but self-neglect is failing to perform essential self-care such as food, water, or medication. For self-neglect, if we go to a person's home and if their house is just filled of hoarders, clutter, if they choose to live that way and it's not affecting them medically or anything, we can't do anything about it, unfortunately. I've been to houses where you start in the front yard, and as you walk, you're going through a maze with stuff stacked on both sides. And I know it's hard when medical professionals and people go out there to assist those clients and they see that type of stuff. But unfortunately, we're going to investigate. We're going to do everything on our end as much as possible to seek help for that client. But if they refuse, we can substantiate the case, and that's pretty much it. Now, if the client was in the home and they're laying in their own feces, can't move, their home is hoarded and a lot of stuff, then we can step in and do something. But long as they're able to move throughout the home, take care of their needs, have no cognitive issues or, very mild cognitive issues, it's nothing, again, we can do because of self-determination. Next slide, please. Sexual abuse, any kind of sexual behavior. Anybody had a question?
Well, this is Susan Gallagher at New Horizons. I just wanted to reiterate about hoarding and that point that you brought up, that there is choice. Hoarding is it's in the diagnostic code. It's a form of OCD and it's related to anxiety. But again, individuals have choice to receive treatment. And when the hoarding gets to a point where, like you said, the house is unsafe, there's feces, there's bugs, you can report them to inspections and codes. But just be aware that hoarding is a form of OCD, which is an expression of anxiety. That's all I wanted to say. Thank you.
Mm-hmm. Yes, ma'am. Yes, ma'am.
Thank you.
Okay. Thank you. Sexual abuse, any kind of sexual behavior directed towards an at-risk adult without the person's full knowledge or consent. Indicators of sexual abuse is any non-consensual sexual contact, inappropriate touching, forced viewing of sexually explicit material, sexual assault or rape, sexual harassment. Financial exploitation. And again, I say we see a lot of this going on within the elderly population. But basically, it's the improper or illegal using of a person's resources for any person's benefit or another, for personal benefit of another person. Excuse me. Indicators of financial exploitation: misuse of victim money, missing valuables, unusual activity on bank accounts, unpaid bills, rent, utility lights, taxes, etc., unexpected eviction notices or foreclosure notices. Who should report abuse, neglect, and exploitation? For persons living in the community, Georgia law requires mandatory reporting of a suspected abuse, neglect, or exploitation by certain professionals who are mandated reporters. Mandated reporters are medical providers, dental providers, pharmacists, physical occupational therapists, coroners, medical examiners, nursing personnel, psychologists, licensed counselors, social worker, employees of public and private agencies, in a professional health-related service to elderly person or disabled adult daycare personnel, any employee of a financial institution, law enforcement professional, administrators, managers, or other employees of a personal care home or a nursing home are all mandated reporters. Back to failure for mandated reporters to report abuse, neglect, or exploitation of a disabled adult or elderly person is punishable by a criminal misdemeanor. Mandated reporter must report suspected abuse to either Adult Protective Services or law enforcement. But we also have to keep in mind that APS are not first responders. Please call 911 if someone is in immediate danger or you suspect any type of abuse. Again, contact law enforcement if you suspect abuse. If the suspected abuse, neglect, or exploitation occurs in a person's home or other community settings, then contact Adult Protective Service Central Intake. That number is, if you're in the Atlanta area, 404-657-5250 or 1-866-552-4464, option 3. Your report is confidential and the law protects anyone from a lawsuit reports abuse. This is just, again, the contact number, and you can also report online. We have a lot of hospitals and medical facilities, doctor's office that reports online. Mm-hmm. Nursing home facilities, personal care homes, and community living arrangements, if you suspect abuse in any of those types of settings, you will have to call the Georgia Department of Community Health, Healthcare Facility Regulation, who is responsible for investigating those reports. And their number is 404-657-5728, or you can call them toll free at 800-878-6442. And they also have online reporting access. You have access to report online. If you want to file a complaint about a licensed care facility or a service provider, call 1-800-878-6442. Leave your contact information and someone will be contacting you. You can also fax that complaint to 404-657-5731. If you go to a personal care home or licensed facility and you're not sure if they're licensed, you can go online to www.georgiamap2care.information to verify if that facility is licensed. Long-term care ombudsman is different from APS. If someone you know needs an advocate in any of the long-term facilities, you can contact your local ombudsman, who is authorized to assist those clients in the licensed nursing home facilities. Their number again is 866-552-4464, or you can call the Office of State Long-Term Care Ombudsman at 404-463-8383. At River Valley, I've included in the slide our team. As you all have already met my supervisor, Ms. Melissa Brown, and myself. Some of you have maybe spoken to the following investigators: Katina Baker, Leslie Barrett, Renato Bass, Pamela Bruce, Gwendolyn Hendricks, Jasmine Harris, or LaWanda Jenkins. Those are the investigators under the River Valley Region team. We service 16 counties. I've listed the counties below.
All right. Well, Ms. Johnson, that was an amazing presentation. I'm sure you answered several questions for us. I know with River Valley working with APS so much, you actually just extended my knowledge a lot, and I really do appreciate that. I don't know why I was in the impression that APS was somewhat of a first responder. So when you
a lot of people think that, and policy is we have 10 days to get out on a call unless it's a priority. If it's a priority, we have 48 hours to make contact. If it falls on a Friday, at the end of the day, what we do, we call law enforcement to go do a welfare check, and they will call us back to tell us what they see and do we need to take action immediately, or if that client is safe over the weekend. But come Monday morning, we're at their door.
Okay.
What constitutes a priority?
No water, the abuse, you know, I'm trying to give you a good example. Recently had a guy that was living home alone. He was in a wheelchair. He could not walk. He had been in the home for 2 days, sitting in his own feces and urine, hadn't ate in 2 days. That's a priority. Move quickly. And in that situation, ambulance was called and he was taken to the hospital, and we followed up at the hospital. But again, it was kind of a self-neglect situation, but we still made the proper, spoke with the family and the doctors, and he's now in a home. By his choice, he chose to go into a home.
Okay. Well, Ms. Johnson, we want to thank you for your portion of the presentation. That once again, that was extremely awesome and well informative. So now we are going to have one of River Valley's very own, Miss LaCarole Lloyd. She's our MDS-Q options counselor, and she's going to briefly introduce herself and discuss some of the programs that she works under.
My name is LaCarole Lloyd, and as Ebony stated, I'm with River Valley Area Agency on Aging. I am the MDS-Q options counselor, and I will be speaking with you today about MDS-Q options counseling. And I know many of you may be wondering, what is MDS-Q? So MDS is an acronym for minimum data set, and section Q is a part of that assessment that is done by social workers. The entire assessment is federally mandated, and it is done in all Medicare and Medicaid certified nursing facilities. And I went over what MDS-Q means. And so MDS-Q options counseling is interactive. It's an interactive decision support process, and it assists individuals who reside in nursing facilities determine their appropriate long-term support choices. It's personalized counseling over a period of time, and it allows them to make informed decisions about their own life. It's person-centered, and I focus on their wants, values, and preferences. I collaborate with the local ombudsman a lot and other community agencies. So I have a special note in here about guardianship. Guardianship is very important. So if an individual has a guardian, I will need legal documents, and I will have to contact that guardian. So I'll need their contact information. So basically, the guardian has the final say. After speaking with that individual, the guardian can basically help make a decision based off, after considering, what their needs are. They can make a decision on if they're able to move on with the options counseling process or just remain in the nursing facility. And if an individual does not have a guardian, there's nothing the family can do. A lot of families get upset with me and they say, well, you mean to tell me y'all are gonna let them leave the facility? Well, they have what we call a dignity of risk. And they have the right to make their own decisions, even if it's risky to us, even if it seems risky to the family. They have that right. So if an individual does not have a guardian, even if they have a power of attorney, if they're still able to speak for themselves, they can still make their own decision. So there are 2 transition programs. One is the Community Transition Program, what is known as Money Follows the Person, and the Nursing Home Transition Program. So the Community Transition Program, Money Follows the Person, it is federally funded, and the individual must be in the facility, including the hospital stay, for at least 60 days. They must apply and receive at least 1 day of nursing home Medicaid. They must get community Medicaid. they must be enrolled in a Medicaid waiver program. And the Medicaid waiver programs, they want individuals to be able to transition out safely, and the Medicaid waiver programs will send someone in to help with their personal care needs. With the nursing home transition program, that's mainly for individuals who are in short-term rehab, and they must be in the nursing home or a short-term rehab facility for 20 days, and that's consecutive as well. Can't be a break, can't be where they go home after they leave the hospital and then go back and then go into the nursing facility. That won't count as 20 days. The 20 days will start, if that's the case, it'll start on the day they enter the nursing home. They must be 55 years or older. They must be a U.S. citizen and have legal status, and documentation is required. Normally for U.S. citizenship, a state photo ID is fine. Their income must be below $6,175. So the transition program can provide many things, including security and utility deposits, furniture and other household items, moving costs, environmental modifications, such as a ramp, if a ramp is needed, if grab bars are needed, if doors need to be wider in the home, if they need a roll-in shower, that can be done through that program, through these both programs. Also, they offer connections with peer supporters and other community resources, and additional individualized services based on that person's needs. So making a referral. Referrals are made to our agency, to me, and they come from Section Q, as I stated. They come from informal conversations. So if you're just speaking with someone and they're, thinking about maybe wanting to leave the facility, a referral can be sent over to me. Ombudsman program, I get referrals from the ombudsman a lot. The resident themselves call and make referrals because I do outreach at nursing facilities, so they have my contact information. Family members, friends, or local agencies can also make referrals. The nursing facility fax over their referrals, but a phone call is fine. If for individual family, friends, a phone call will work just fine. And then I'll contact the nursing home to get the documents needed. You can reach me. My direct line is 706-256-2921, and my email is LLL, so it's my first name, initial, and then Lloyd, so it's a lot of L's. LLLOYD@rivervalleyrcaaa.org, and we serve 16 counties as well in the River Valley area, and those are down here on the slide as well. And that's it. Do y'all have any questions or anything for me?
I have one, and this is, I should know this, but I don't. You said the income was $6,000 something. That's a month, not a year, right?
Right, so it's per month. It's $6,175 per month, which most people don't make. I have had a few people that made over that amount, but most individuals who are in the nursing facilities, their incomes are not over that amount. So most individuals who want to get services through the nursing home transition program are able to.